Hey folks, welcome to Medical Samhita. What comes to your mind when you listen the word nursing? What actually nursing is? Do you want to know? Let's know.
Nursing is a profession within the healthcare sector focused on care of individuals, families, and communities so they may attain, maintain, and recover optimal health and quality of life. Nurses play huge role in healthcare system. A nurse is a bridge between doctor and patient. She is compassionate, understanding, and non-judgmental, yet firm and grounded. Nurse is probably one the most important yet least appreciated person in patient's life. So we say, save one life, you are a hero. Save 100 lives, you are a nurse.
Let's know about origin of nursing. In 5th century BC, the Hippocratic collection described the skilled care was provided by male attendants who may have been early nurses. In 600 BC, the role of nurses was mentioned in the book written by NUSING. The members of religious orders such as monks and nuns provided nursing care before the foundation of modern nursing. Therefore, nursing care was provided by unexperienced traditional caretakers. Nursing professionals suffered a major setback for 200 years. Then the era of nursing has come. Florence Nightingale, who was the English social reformer and statistician, has stepped into nursing in 1850s. Florence Nightingale was the founder of modern nursing. She has written over 150 books on nursing. The role of nursing and nursing education was first defined by Florence Nightingale.
In October of 1853, the Crimean War broke out. Thousands of British soldiers were sent to the Black Sea, where supplies quickly dwindled. By 1854, not fewer than 18,000 soldiers have been admitted into military hospitals. After receiving a letter from Secretary of War, Sidney Herbert, Nightingale was ready with a team of 34 nurses. Her contribution was immense that reduced the death rate by 2/3. People called Florence as Lady with the Lamp and others simply called her Angel of Crimea. Hence we celebrate her birthday as Nurses Day on 12th May of every year. Then in 1868, the Trained Nursing College Regiment was established by Agnes Jonas in Liverpool. Then the hospital-based nursing training came into frontline in early 19th century.
Coming to Indian history of nursing, until 17th century, formalized nursing was not praised. Every village had a daya who was a trained birth attendant.
In 1871, Government General Hospital at Madras was started with the first school of nursing for midwives with 4 students. Then many nursing schools were started in different states of India between 18th to 19th century. The first 4-year basic BSc nursing program was established in 1946 at RAK College of Nursing in Delhi and CMC College in Vellore. Then in 1960, MSc Nursing was established. Indian Nursing Council was established to maintain a uniform standards of nursing in India. Then INC Act was passed in 1947.
Coming to the statistics of nursing, at the time of independence there were only 7,000 nurses for 400 million population. India has only 0.7 doctors and 1.7 nurses per 1,000 population. Our country needs 2.4 million nurses. Demand of nurses increases every year. At present, there are 27 million nurses in the world. WHO estimated, seeing this growing demand of population towards nurses, 9 million additional nurses are required by 2030.
Some of you may have doubt, is nursing only a female profession? The answer is no. Though the ratio of male and female nursing is unequal, the nursing has been portrayed as a feminine occupation since ever the appearance of Nightingale nursing training style in the mid-19th century, which favored women over men to become nurses. But in fact, according to Mr. Rose, the first nursing school in world included men only and started far back in 250 BC in India. Male nurses cared for the troops during crusade in 11th century. The contribution of nurses towards the world are unparalleled. During the World War, nurses worked closer to the front lines than they ever had before. Within the chain of evacuation established by the Army Medical Department during the war, nurses served under fire in the field hospitals and evacuation hospitals, on hospital trains and hospital ships, as flight nurses on medical transport planes. And we know the contribution of nurses during pandemic, how they stood like a soldier in front of the deadly virus, leaving the family for months. They didn't even see their children's family, and how they were fighting for us. Hence, WHO designated 2022 as Year of Nurses and Midwives in recognition of vital role which nurses and nursing midwives play. Here are some world's most popular nursing professionals. Florence Nightingale. As we discussed, she is the founder of modern nursing. She became nurse in 1851 and served soldiers during Crimean War. Many survived because of Nightingale's proactive approach. Clara Barton. Clara Barton is known as America's Angel of Battlefield. Barton was deeply affected by the lack of medical supplies available to the wounded soldiers. She took action and took medical supplies to the battlefield. Barton also founded the American Red Cross in 1881. Then Mary Breckinridge. Mary Breckinridge became registered nurse in 1910 and introduced nursing midwifery to US. Founded the Frontier Nursing Services in 1925, provided prenatal and postnatal nursing midwifery care to women. Dorothea Dix spent 40 years of her life for mental health care. Dix founded 32 mental institutions throughout her career to facilitate the nation's growing need for better mental health care. She also tirelessly campaigned for the rights of mentally ill people. Mary Elsa Mohne. Till Mary Elsa Mohne made an appearance, African American nurses didn't exist in the American history. She born in 1945, first African American woman to graduate nursing school in US and get a job as a professional nurse. If you find this video informative, please like, share and subscribe. Please comment on which topic you want to listen more from me. Thank you.